Thank you, Mr. Chairman. Again, my name is John Hawkins with the Texas Hospital Association. I have provided some written testimony. In the interest of time, I'll go through it pretty quickly, given the late hour. You've had a lot of discussion about not continuing to pay providers the same way and expect the same outcomes, and I can assure you we are doing nothing the same in the hospital payment system as you did last session. In fact, I provided a list of about 20 different elements of payment changes that have been made to hospital payments. Certainly, I think at the end of the day, it was the right thing to do from an outcome standpoint. By our calculation, you did extract about $700 million out of the payment system for hospitals, and what we're really asking for, I think, is stability in the system. I've also, as some of the other members have indicated, you have to read that in context of what's going on at the federal level as well, and I've provided a chart that stacks the state cuts that you've made onto what we're dealing with in D.C. And Senator Dewell, part of the financing for ACA is about $500 billion in provider cuts in Medicare, and hospitals are on the hook for $155 billion. That's going to be about $13 billion in Medicare cuts, probably another $5 billion in DISH to us over 10 years. So we are very invested. And then sequestration, certainly, if we don't get that worked out, is going to be a real problem. And this, frankly, is not sustainable, which will bring me to a discussion about Medicaid expansion as we wrap up. But in the interim, let's keep an eye on the base rate. We're now down to about 50% of cost inpatient, 75% outpatient. We have made that work through the supplemental payments, DISH and UPL, over the years, but we know, those are potentially diminishing. DISH is going to be reduced at the federal level. UPL, we had to transition to a waiver because of managed care expansion. Again, the right thing to do, but that's a 5-year waiver. We don't know where that's going to end up. So rates are very important. We do have a problem with DISH. You all had a good discussion about that yesterday. The waiver has changed the game on DISH. We've over-relied on the public hospitals to fund that. There's some fiduciary issues there, so some state funding would really go a long way to help equalizing the DISH payments, which are very important to hospitals going forward. And finally, on Medicaid expansion, Mr. Chair, I appreciate your comments this morning. I very much do believe we certainly do not want to continue to perpetuate a system that does not work well, but we certainly ought to use the leverage that we have to entertain a discussion with the federal government about taking advantage of this funding, again, which we're on the hook for one way or another, and doing it in a way that better delivers that care with personal responsibility, better cost containment. So we look forward to continuing that discussion.
Thank you. We'll look forward to visiting with you.